Good morning, ladies and gentlemen. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in. Today, well, it is a Friday version of the show, folks, and in its most well-known tradition, it will be a Get 'em Up, out-of-town version of the show. We come on in and ask you to go and dial us up and find out what's on your mind. You can raise a question, make a comment. Any form of communication is okay with me. A lot to talk about. We've been having a number of interesting topics over the course of the last couple of weeks at least, if not way beyond. So if you've got a mind to do so, dial us up by hitting these keys, 412-825-6262. That's 412-825-6262. The way it works, I listen for that knock on the door, and I'll let you in the store. We'll find out what's on your mind. Now, a number of things I've got on my plate today. A couple of things in the news. The new statin drug. Had a big thing on Monday about cholesterol and statin drugs and how unworthy they are of really being in the medical realm at all. But we now know the name of the next statin. I'll tell you a little bit about that one. Also, too, as much as we've talked about CT scanning, finally a blurb in the literature about how harmful they really are. Didn't think I'd find it. Lo and behold, there it came. It popped right up. And then finally, conventional medicine's answer to why you should have mammograms. Caught my interest for sure. Had to share it with you, and that's what's on my plate. What's on yours? Once again, the number 412-825-6262. I'll listen for that knock on the door, and we'll do that right after that first break. Okay, up-and-coming activities. What's going on around here? Well, as you should know, we've been involved with microcurrent therapy for many months. Gets it started way back in November, December, when we had Shannon Gosen visit us on Mondays quite frequently. She was the first to really get us acquainted with frequency-specific microcurrent. Then we pick up where she left off with Mr. Mike Legal and Lynn Teachworth on an Avasia unit. Now, that's not frequency specific, but it is a microcurrent unit that is exceptionally good for pain problems. We've been talking about it ever since, and lo and behold, your interest peaked so much, I knew we had to bring the training to you to be able to utilize this device. Now, you certainly can learn about how to use your device on you by us here in the office. But many of you are practitioners, and many of you, even though you're working on yourself, you want to learn more, and it just so happens that you'll be able to do so because Avasia training is coming to town. It'll be here in August. It'll glom on to the tail end of a national convention for massage therapists. That convention will be held at the Lawrence Convention Center, and it'll be in the month of August. The dates specifically are the August 19th all the way to the 22nd. Now, the 22nd is a Saturday. The conference comes to a conclusion, but we thought it was very appropriate since we'll be one of the vendors in the vendors hall, and many of those practitioners may very well want to purchase units, and they would sure like to return home after the conference to be able to use them on Monday morning. Well, with that in mind, at least, we said perfect place to have this conference in town. Same place as the conference, the festivities for the massage therapy, the national conference, and then put it right in the tail end before they go back. And then what a perfect way to let Western Pennsylvania residents, clinicians, or non-clinicians alike become equally trained. So we can now announce and have been announcing for you who have that interest. You can go ahead, do two different things now. If you do not have an Avasia unit, and of course many of you don't, easily enough for you, head to the website at First Alternatives. That's firstalternatives.com. And on the opening page, click on the icon marked Training. Now, that'll just walk you through and get you to a registration page. There's a PayPal on there so that you can take care of the enrollment fees. And you will be done and warm as toast and ready for the 8:30 arrival time on August 23rd at the Westin Hotel downtown. Happens to be the one that is glommed onto the Lawrence Convention Center. But I understand all the hotels down in Pittsburgh will be involved with housing the participants. There are just so many that one hotel couldn't handle. They were well overflowed. But it's the perfect place for us to offer that for those out-of-towners that really don't know Pittsburgh at all, and for you Western Pennsylvania folks to go on down there on Sunday morning and spend all day with us for that training program. So if you do not have an Avasia unit, easily enough, head to firstalternatives.com, click on Training, it'll walk you through. You'll be done in 5 minutes, and it's a done deal. See you on the 23rd. If you do have an Avasia unit you've purchased, well, it really doesn't matter when you purchased it. You're entitled to a substantial discount, but there's no way for you to enroll to get that discount at First Alternative, so you'll need to come at 8 o'clock on the 23rd at the Westin Hotel so that we can enroll you and you can get that discount because the paperwork will be able to be filled out appropriately so that we can apply it to you. Anyway, Avasia is coming to town. I promised to get both Mr. Mike Legal and Lynn Teachworth here in the next week or so to try to prepare you who are coming or may decide that you want to come to give you further information on what you can expect. But Avasia is going to be playing a big role here in our office. We are known as the site for all the education and the use of that unit, literally for the entire Western Pennsylvania region. We're really proud to be affiliated with them. Okay, other things going on here. Folks, we just finished program, I think it's number 3. I programmed yesterday. There were 5 participants. We do groups of 5 or less, and every single one of those participants had cataracts. That was our newest and our hottest thing, folks, working with cataract patients. And many of you out there may be intrigued to know they all hit home runs out of the park. I use the term home run because they all had their vision improved so much that these 4 days were extremely successful for them. Now, they were evaluated by me, and they were evaluated by Dr. Lisa Bowen. I'd love to bring her back soon so she can talk about her subsequent experiences with these patients. After all, she came on our show right after the first group. But just to keep a running tally, folks, we're doing extremely well, close to 100% response. And for those of you who have cataracts, that's something you need to know. The next group, because we're so busy here in July, we're actually doing a second group of patients next week, and I'll tell you all about those too, and let you know about how they do with their 3- and 4-day programs. But the fact that the eye treatment offerings are now absolutely entrenched, involving cataracts as well as the retinal diseases. As you know by now, Dr. Edward Condrat put these programs together a long time ago, 15 years in fact. He was a very busy ophthalmologist here in Western Pennsylvania. His office was in Mount Lebanon at the time, but he chucked it all in 15 years ago, headed off to Phoenix, Arizona, and he put these things together. I guess people at the time thought he was crazy, but he had a method to his madness for sure. And for the last 15 years has been traveling all over the United States, pulling every so often into a pretty large town and treating people who were from the region at least for the 3-day programs that he was offering. It got to the point where he said he didn't want to do any more of those, and that was our advantage because we were immediately named by Dr. Condrat as his northern affiliate here in Western Pennsylvania. And you've been hearing about the story with eye programs ever since we took the helm back in July of 2013. So we're just completing our 2-year anniversary, and what better way to complete it than to have an offering that wasn't even possible when we started. We started to work strictly with retinal diseases, things like macular degeneration, glaucoma, diabetic retinopathy, macular hole, macular pucker. Yes, there is a disease called macular pucker. Retinitis pigmentosa. The list goes on, but these are all retinal, and unfortunately, if it's retinal, really not much to offer you from the conventional medical world, but so much to offer you with the world of Edward Conrad. We are known here in Western Pennsylvania as the Pittsburgh Eye Protocol. And so if you want to find out more about these programs, you can do a couple of things. One, head to our website at pittsburgheyeprotocol.com. There you'll read about what we do and how we do it. We do link on to the website of Dr. Edward Conrad, which is really a busy site. A lot going on that site. Sometimes you get just lost in there, and that's why we thought we'd link on to the appropriate areas we want to send you to. But if you wanted to browse and read on what Dr. Conrad's involved with, just go to healingtheeye.com. Of course, he runs the Healing the Eye and Wellness Center, now located in Fort Myers, Florida. That's the headquarters, folks. And then there are sporadic doctors throughout the country that do these programs more locally. We were the first affiliate. We remain the top affiliate. We love working with you folks with the eye issues. Once again, pittsburgheyeprotocol.com. Or if you got some specific questions, you want to post them to Sister Sarah. She's our go-to on all these programs. The number to do that, to talk to her directly, is 724-993-0500. That's 724-993-0500. The discs are available. We put these discs together, more about eyes, a lot about eyes. But there were so many shows that had a tie-in to what we could do for correcting eye issues that we finally put them all together. Sort of like we did with Dr. Schallenberger shows. You requested them so often, we finally put them all on a disc. Well, you were requesting these so much that we put them on a disc. Here are the entrants, essentially 3. One is the show that Dr. Conrad did with us back in December of 2014 when he got his dander riled up after reading about the treatment of wet macular degeneration. He was so upset that he called me and said, "Got to come on. We got to do a show." We entitled the show. He entitled the show, and I said, "Absolutely, sounds like a great title to me." Here it was, "The Watergate of Eye Care." Those of you of this age group know what we're talking about. Turns out there was its own conspiracy going on in medical care when it comes to the treatment of wet macular, and Dr. Conrad was not too happy about it, and that show is on the disc. Another show, we met Todd Wiley, Dr. Todd Wiley from Spokane, Washington, who was the first to talk about taking care of cataracts through the use of a device called the beamer. Now, both have become famous, Dr. Wiley and that beamer that he brought to our attention, because we couldn't get it soon enough here in the office. It has turned out to be helpful to all. We'll probably have to do another special show just on the beamer, which is a device of a category of devices referred to as PEMF. PEMF stands for Pulsed Electromagnetic Field Therapies, and of course the beamer is one of those. The benefit to eyes was brought to the attention to us by Dr. Wiley. We brought him to you. We included his show on the disc. And then finally, after we finally put our own program together, we had our first group of patients going through to treat their cataracts. And they did so well that we brought them on the show and the doctor, Dr. Lisa Bowen, to discuss the results of it. Those 3 shows have been requested. They are platinum, and they are available on a disc. Call in to get your disc by either dialing us up at 724-942-3002. It's a $5 fee for the disc. Not much, folks. Just the cost of recording it. and then you can have it too, either for yourself if you have eye afflictions, or get one or a couple to pass them on. I think people who are having issues with either retinal diseases or cataracts would really appreciate it. The discs are available once again 2 ways, 724-942-3002, or just call Sister Sarah at 412-993-0500. We'll let it go at that. All right, folks, let's take a short break. We're shifting some gears now. You can come on in any moment and set the agenda as you see it. You do so by dialing it up at 412-825-6262. That's 412-825-6262. I'll be back in just a moment. Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. We're here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Friday morning version of the show. And yes, we have made it and declared it a get 'em up out of time version of the show. You can come on in here anytime you've got a mind to do so by just dialing us up at 412-825-6262. You can call up and ask a question. You can make a comment. Any form of communication is okay with us. And well, let's see where you want to take this and drive this thing for a little bit if you'd like to. I'll be driving it up until that point. A number of issues that cross my desk. I'm always on the computer searching the various literature out there. And lo and behold, I come across things that I'd like to share with you. This one, especially after the show I did on Monday. Now, I'm going to refer you to the show. I consider it one of my platinum shows because I can't ever remember delving into the cholesterol issue as an in-depth way that I did on Monday's show. And so if you have, and if you're one of the few left that still do, have the cholesterol scare put into you by the conventional medical community, you can get unscared pretty easy by listening to the show that I did on Monday. Cholesterol is not a bad actor. It is not a bad player. It is a vital player. And rather than going through all that, let's just say you'll want to go listen to the show that we did on the 20th. It'll be on the list of platinum shows up and coming. We're going to be publishing that. I'll tell you more about that in a minute. Now, I told you that the reason for having done the show just prior to me going over all the details of the show on Monday was that a lot of activity was hitting the literature on getting you ready for another round of statin drugs. Well, we just found out what that name is going to be. We know the category it's going to be found in, and we also know the price. Get a load of this. Anyway, the byline that I came across is Europe approves Amgen's first-in-class cholesterol drug. And so wherever this company Amgen is, I'm not familiar with them, but on Tuesday they received European approval for its first-of-a-kind, they say, cholesterol drug that lowers levels of the artery clogging substance. Boy, they got this wrong. The artery clogging substance more than older drugs that have been prescribed for decades. These drugs have been around since the late 70s and the early 80s. And they work on this premise, and we just got to get in the weeds a bit, that cholesterol is bad, lowering cholesterol is good, and since they sold that to us, hook, line, and sinker, back in the 1970s and 80s, they've been ramming it down our throats with one statin drug after another, and doctors literally becoming apoplectic on looking at cholesterol levels. They don't even pay attention to the cholesterol issue. As low as they can drive it, they think you're the healthier for it, and they have made a giant mistake. Anyway, this highly anticipated decision from Amgen introduces a new option for patients at risk for heart disease. Now, once again, I guess it should be appropriate to mention there is one group of patients that do benefit from statin drugs. The benefit that those patients get from a statin drug has nothing to do, and I repeat, nothing to do with lowering cholesterol. That's actually the problem of the statin drugs. The fact that it does non-discretely lower cholesterol is not a good thing. But they keep ramming that issue home. You've all glommed onto it. You allow it to make sense in your own mind. And I've been taking some pretty extreme steps to try to convince you otherwise. Now, they're really excited about this new drug. The name of the drug in Europe, we don't know what it's going to be here. It will ultimately come to us. I can't tell you when, but it's going to be named in Europe a drug called Repatha, R-E-P-A-T-H-A. Repatha is going to get launched in Europe, and then once Europe kicks it around a bit, we'll get an American version, usually never called the same thing. So when it finally comes to us here, it won't be known as Repatha, but there will be a whole new launching by the company that ends up sponsoring it here, and you'll be hearing a lot about it then. Now, get a load of this. Repatha is the first in a new class of medicines that lower bad cholesterol more than statins, which, by the way, probably isn't a bad idea, but is not necessarily a correct idea, and that's been the standard treatment over years. The problem has been in trying to lower LDL, which actually had a bit of a clinical reason to want to do it. They could never lower the LDL fraction alone. They always lowered the total cholesterol, and that was the problem. The one benefit that I alluded to a moment ago for why it is that statins in one group of patients, by the way, that group of patients that has shown that statins help them are males over the age of 50 who have already had a coronary event, already had a heart attack. And that category of patients do get a benefit from taking a statin drug. The benefit that is obtained because of taking the drug has nothing to do, I repeat, nothing to do with lowering cholesterol, and has everything to do with the anti-inflammatory component that statins provides. It's anti-inflammation by statin drugs that allow that one category of patients to get a benefit. But nothing's ever mentioned about the anti-inflammatory component. The only thing gets mentioned is your cholesterol level, and your doctor is on it. He dogs this issue, and it's like the third degree. Every 3 months or so, your doctor says, oh, let's get another lipid panel. Let's take a look at that cholesterol and keep on riding. And I said on Monday's show, if that sounds like your doctor, looks like you need to move on. This guy is about 30 to 40 years behind the time, but every so often they get energized by stuff like this article, and so that's why I brought it to your attention. Anyway, the cost. Get a load of this. Now, statin drugs, I guess, are relatively inexpensive, relatively speaking. But get a load of this. The questions about Repatha is that the price is, I think, going to be a little bit of a problem for American public to swallow, because you see, it's estimated by one analyst that it will cost about $3,750 per year once it gets outside the U.S. $3,750 for a drug that does something that you don't want it to do, by doctors who order it because of their lack of understanding of how it is that a statin could even help you. If you're under 50, or if you're a female, and if you've never had a heart attack, none of these drugs can help you at all. And we'll let it go at that. Hey, we got a knock on the door. Come on in the store. Hello, welcome aboard. What's on your mind? Go right ahead.
Yes, Dr. Courtney. I was wondering if the microcurrent therapy is covered by insurance. The Avazio?
Because of, the answer is maybe, okay? And I put the underline maybe because the Avazio unit is granted its approval by the FDA as a TENS device. Now, it's not a TENS device, because that's a technology 30 to 40 years old, but it is a technology that is well understood by the insurance community. They've been covering the cost of TENS units for at least 30 or 40 years. So the answer to your question is there very well may be a way that your insurance company can reimburse. What we find is at least partially back to you, and I never know what partially means, but at least the answer is yes, there is insurance reimbursement by most insurance plans for these devices. I just can't tell you how much.
Yeah, okay. But what's the difference between the Beamer and the Avazio?
Two different technologies. Remember, microcurrent, which Avazio is a representative of, is the ability to impart electrical activity into the body, meeting certain specific frequencies that tissue resonates at, and in so doing, take unhealthy tissue, which isn't resonating, I guess a better word is vibrating. It isn't vibrating at the proper frequency. These devices reestablish that frequency. Now, that's a far cry from the Beamer, which is not a microcurrent device. It is an electromagnetic field device. I guess about the only thing that is similar between the two is all body tissue has two unique signatures, only unique to itself. It has its own frequency, and it has its own electromagnetic field. To think that you can actually intervene in these two signatures is the real bonus for both technologies, but they come at you in different ways. But when they're used together, the combined effect is, it's nothing short of miraculous, and the very many people that are taking advantage of them are finding that out. So come on in. If you have any medical issue, please come on in. If you have a pain issue, the Avazio is probably the place to start, as well as combining it with the use of the Beamer. Since we've introduced the Beamer about 8 weeks ago, have had very little complaint in terms of how rapidly the patient gets a benefit. I think that's probably the biggest thing with both of these devices. They're always profound, and they're always immediate in terms of the response.
And one last thing, are you going to get a interview with someone who does adult cell therapy, adult stem cell therapy?
Funny that you should mention it, because been currently just this week negotiating and discussing the use of amniotic fluid, which isn't really a stem cell, but it is a way to bring healing factors that are harvested from amniotic fluid. So I will certainly look for and find speakers who can come and have a discussion about stem cells, but I'm already negotiating with a group that's able to supply me with freshly and appropriately prepared amniotic fluid. And the moment I can get that put on the drawing board, I will bring those experts to the show. They're always coming aboard here. We are looking for the newest things around, and stem cells are really hot right now. I can't understand why you want to hear about them. We just haven't found stem cells to be completely reliable or safe. And so until we reach that point, probably won't offer them. Nonetheless, the amniotic fluid stuff is completely safe. We'll be offering it, and you'll hear more about it in the up-and-coming very near future.
Well, thank you. I am looking forward to it.
Keep on listening. Glad to have you aboard, sir. Here you go. Stem cell hot item, but you can't find anybody that's using them outside of the investigators. And so it's happening at a scientific and research level, but the amniotic fluid is well beyond that, and it looks like it has great possibilities. Hey, we got another knock on the door. Come on, the store. Hello, welcome aboard. What's on your mind? Go right ahead.
Hello, doctor. How are you?
I'm very well. How can I help you?
Hey, how much accuracy can we put on these oligoscans and these etascans?
The oligoscan. What did you call the other scan? A zeta scan? The Zyto. ZYT. Does it mean the Zyto scan?
ETA scan.
ZETA, correct?
E as in Edward.
Uh-huh.
E as in Thomas. A as in Apple.
ETA. Well, you're going to have to, I don't know what those call letters are in an acronym for. Could you maybe explain what you mean by ETA scans?
It's a frequency scanner that detects all kind of frequencies in your anatomy.
How about
gives you readouts of anything from stressors like viruses and.
All right, I got a good picture in my mind. To me, that the ETA scans you're talking about are biological terrains. They're based on the energy flows that follow through the meridians of the body, and then can be recorded via computer to find out how healthy these frequencies are by various computer programs, and usually probes that are like go along the fingers and the knuckles and the hands and the things like that. Is that what you're talking about?
It's a computer scanner.
Okay.
Scanner. I guess you just put this device around your neck and it picks up frequencies and it lights up the computer readout.
All right.
It gives diagnostics.
Looks like another variant where you wear something around your neck that I am not familiar with. Let's just say the use of meridians and biological terrains has been well established over, my goodness, 40 or 50 years. And so I have seen them match up to pathologies that I've ended up treating where the tip-off was the actual study to be done with. As far as this device that you hang around your neck, I probably don't know enough about it to comment on anymore, so I'll wait to find out more. Whenever
What's the oligoscan?
The oligoscan, that's something completely different. Now, the oligoscan is a highly accurate way of determining what the status of heavy metals is in your body, but in a way we've never had the possibility of doing before. When I wanted to find what metals were, and really up until recently, and even today, one of the ways that have been available to me as a doctor is to do a provocation test, where I had to give you a substance, a chelating substance. It pulled the heavy metal from the tissue where it resides in, because it's never found in the blood. But when I gave you the provocative agent, it pulled the heavy metal from the tissue into the blood, and then one passes out of the body through the kidneys, and you analyze the urine. The metal comes out in the urine. It's been a standard way that medical doctors have been able to test for and then alleviate the heavy metal burden the patients have to hold up against. The oligoscan is a device, electronic device, which can read the presence of heavy metals in the tissue themselves. Not pulling it out of the blood, the body parts first into the blood. It's able to register what the amount is in tissue just by placing a device directly over top of the tissue. Now, the part of the body that's involved with this is the hand, and so this device takes 3 or 4 readings in the palm of the hand, sends those readings via the computer lines to some place in France, and within 30 seconds the results come back and is able to be accurate almost to the penny. 95% or higher accuracy with the amount of metals happening in a few seconds. I feel that it's extremely accurate and has nothing to do with the meridians, has everything to do with the ability to detect certain molecular weights and the compound weights, and sort of a mass spectrometry way of doing things that's highly accurate. So oligoscanning, which we were supposed to have in this office, and have a delay. We will not be able to get our scanner until September, but you hear all about it whenever it's available to us.
Well, I just had one done.
Oh, good.
And
they're accurate.
I wasn't surprised to see that I have heavy metal.
Well, and by the way, have you ever had heavy metal testing done the conventional way in the past?
No.
Oh, okay. Because my question would be, I have plenty of patients that I'm dying to find out, and there should be a complete parallel. Those who have done provocation testing in the past, and I have, sometimes multiple tests on them, I'm waiting for the opportunity to do oligoscanning, because I should find the tests should be exactly the same. They should be equally revealing of the same metals, essentially to the same degree of metal toxicity, no matter which form you use. Right now, I can't tell you that, but I will be investigating that when the device becomes available to me. Okay?
Okay. I do have metal fillings, so I can't be surprised. So.
No, especially was mercury one of the metals that it detected?
Correct.
Okay. So that was no surprise, and certainly makes me feel good. I think it's so accurate. The only question to me is the distribution of these metals is what becomes important. Because if I'm using oligoscanning, I'm detecting the level of metal in your palm of your hand. And is there going to be a difference between what metal I find in the palm of your hand versus what metal I might find in the shoulder? Or how about this in the jaw? Or how about this in the brain? Or is there some sort of a washout by the time you get to the hand that doesn't come up with the same set of numbers? This is the answer to the question that I posed but don't have an answer to yet. When I get one, I'll let you know.
Okay.
All right, wonderful questions. Thank you very much for the call. There you have it, folks. See, oligoscanning device. Right now, there's a company purchased the initial company that offered it, and we are told that there's going to be a delay, and there will be no oligoscanning devices available until September. Now, it's just right around the corner, and I promise to keep you up to date and giving you a blow-by-blow. Until we actually get the device in our hands. Okay, let's do this, folks. Let's take a short break. When we come back, still opening it up to you. You may want to get in on this while we're in a break. The number to do that is dialing us up at 412-825-6262. That's 412-825-6262. We will be back in just a moment. Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. We're here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney today with you on a Friday morning version of the show. We've declared it a get 'em up, out of town version of the show where you can come on in and set the agenda as you see it just by dialing us up at 412-825-6262. That's 412-825-6262. I'll listen for that knock on the door, and I will let you in the store. I have made and will started my new salvo of responses to the up-and-coming month of October. It's always a bad month for me, in a way, because I just do not like the idea of women being hurdled into getting mammograms in that month under the guise that the best protection is early detection. I agree with that 100%. But if you followed me over any time frame at all, you certainly know my feeling about mammograms not being able at all to come across with the ability to meet the tenets of that mantra. Yes, the best detection, best prevention, excuse me, is early detection. It's just that the mammogram is not the tool to do it. This procedure is done exactly the same today as it was done probably by Madame Curie way back in the day when she first discovered X-rays. It certainly is exactly the same as the protocols that evolved from the 1950s on to this very day. Hasn't changed one bit. And what has happened is, and as you have followed the course of my revealing to you what's happened, is that each and every year another study gets released and then another study. And we keep on getting studies that say these things are not worth the time and certainly the potential risks that come from it, that you should, ladies, be spending your time with it at all. So obviously it catches my attention when they start it up again. And folks, they have started it up again. By they, I'm talking about somebody out there in the conventional medical community probably getting you ready for October. Not too far away, maybe just around the corner as you move into the fall. But came across an article entitled, "The 10 Important Things to Know About Mammograms." Well, when that kind of topic comes up, it catches my attention. And I was looking at these 10 points, and I find them to be completely absurd and erroneous, but it's conventional medicine's first stab at trying to convince women that they should have these mammograms. As you would well know by now, I am not of like-mindedness, and all of the articles. And I think I pointed this out just last month when I did my last harangue on mammograms. Is the most recent research article was just the final piece of icing on the cake, because in all these years, 15 years worth of looking at these articles, some 30 to 40 articles being written, not one of them supported the use of mammography. Not one of them. Every one of these scientific studies done by large institutions has painted the other picture. Yet, every time we come up confronting another October, it's like nothing changed. It's like nothing said, certainly in the month of October. And I think that probably scalds me the most, that the powers that be just say, you know what, let them go, let them have their month, and let things turn pink, and let's have a good old time this year, and then we won't say anything. All these articles that we wrote, we'll just pull them back. We won't really discuss them in that month because, well, that's really the month for them to do what they do so well, scare women into getting these studies done and utilizing the color pink to get it done. So for the 3 reasons that mammograms are never early detecting enough, because lesions have to be at least the size of 1 centimeter, and at 1 centimeter, that's already too late, because at 1 millimeter, these lesions are already metastasized. That's the part that you want to avoid. And with mammograms, you can't ever know that early. Number two, of course, is that these are barbaric, and that when I use the word squish to describe what happened during one of these studies, women who have had them done certainly know what I'm talking about. I wince at observing these studies being done. I just can imagine what the sensation is on the part of a woman who's having her breast tissue squished. And then finally, the exposure to X-ray. Each and every time you have one of these done, X-ray leads to the very thing that you're trying to avoid, ladies. You're trying to avoid breast cancers, but you keep exposing breast tissue to the assault of X-rays every year or every other year, and you will be provoking changes in the DNA you do not want to have happen, and they literally can provoke the very cancer you're trying to avoid. So look, here's conventional medicine stab, and of course I'll have to take the literary license of making comments when I find them to be in error. So here we go. There's the 10 important things that you need to know about mammograms. Here's point number one. Mammograms can save your life. Finding breast cancer early reduces your risk of dying. By the way, that is so true. Got to be early enough, folks. Has to be early enough from a disease, dying from a disease by 25 to 30%. That's what they're claiming that early detection of breast cancer can do. I say if you get it early enough, it can do much more than that. Women should begin having mammograms early, at age 40 or earlier. This tells me that this is coming from not the recommended protocols, because the protocols that I now have read say mammography should begin at age 50. And it shouldn't be done yearly. It should be done every other year. That's the newest stuff coming from the medical arena. Hey, before we get on to point number two, we got a call here. Come on in the store. Hello, welcome aboard. What's on your mind? Go right ahead.
Hi, Dr. Courtney.
Oh, yeah.
Hi, just had a quick question as far as the ozone therapy.
Right.
Do you have a whole thing of CDs on that someone could listen to?
Well, I think that my whole thing of CDs are the 3 shows that we did with Frank Schallenberger. I mean, he is the godfather of ozone therapy, and he's the one that launched it here on our show January of 2014. It was here January, February, and not March, but in April. And those 3 shows, I call them platinum shows. They're on a disc. Call in to get yours. They're really inexpensive, and if you come in and see me face to face, I'll give you one. All right?
Okay. Maybe it's just me, but I am kind of still confused between the different therapies that you offer. I know I need the ozone, but listening to Dr. Mantell on Wednesday, it seems like the Beamer might be good for me also. I'm just still confused about all the different therapies because you offer so many good ones. It's hard to pinpoint, but I guess if I came back to you, you could pinpoint. I know you recommended the ozone, but you can pinpoint right which ones would be.
Yeah, I just think that no matter 2 things have sort of happened around here. One that's now 2 years old and one that's 8 weeks old. The thing that's 2 years old is this: if it moves, use ozone therapy. I say that in a trite way, but ozone helps in so many things. If a patient comes in, ozone is going to be something I recommend, or at least consider recommending in every single case. So the little paraphrase of if it moves, use ozone, I think is a trite way, but nonetheless pretty accurate. The second thing that we use around here, only in the last week, is if it moves, use the Beamer. So if it's moving, I'm going to end up recommending both ozone therapy and the Beamer. They both do 2 different things, but the benefit of them is so powerful that when done together, the result is going to be exponentially better for you. Okay?
Have you explained the therapies that you mentioned are explained on your website, did you say?
I'll tell you what's going to happen. On Monday, I decided to do Monday's show in all the therapies that we do. And so it's very interesting that you've asked the question that I literally asked myself this past week. And I said, we do so many things. We're confusing a lot of people out there. I think you've attested to the fact that you could be confused by having so many therapies. I'm going to go through point by point on Monday's show and talk about all of them. Okay?
Okay.
And then that'll become a platinum show.
Speaking of things kind of that aren't there anymore, regarding doctors, do you know whatever happened to Dr. Sims in Murraysville?
Dr. who?
Sims, S-I-M-S. I forget his first name. He had mutilation, an alternative.
Boy, you know, I thought I knew all the great ones, and I don't know.
In 2003, but I never was able to find out where he went.
Well, I didn't know he was here, so I didn't miss that he left. But maybe others who are from that area would give us a beat on this gentleman. I'm always intrigued by those pioneers. And
he was a very young man, and I was impressed just a couple of times I was there. You know, all the therapies he had done, and this is, like I said, going back, 13 years.
Well, I'm going to bet you that one of our listeners is going to know what happened to Dr. Sims. I'd love to know what happened to him, and hopefully we can find out. Thanks for the call. And stay tuned on Monday, what we do. Another knock on the door. Come on, the store. Hello, welcome aboard. What's on your mind? Go right ahead.
Yeah, good morning. I would have an answer for Kathy.
Oh.
To the best of my knowledge, he left the area to go back to school for additional training. And the last I heard, he has a practice in, I think, Erie.
In Erie?
The area, but I do believe he's still practicing. And I'm not positive on this, but it was true. So I do think he's in Erie.
Well, thank you. Did you know Dr. Sims? You from in Mobile area yourself?
I went to him back then.
Uh-huh.
He was very good, and he was unusual. You know, that even back then, it's not that far back, but far enough. And yes, and he actually did send a letter saying that he was leaving. So and then I don't know what happened.
Well, look, that's
practicing. I think up north, in Erie, Buffalo, but I think it's Erie.
Hey, that's great. Look how quick that happened. If anybody can add to this so that we can answer the question, where is Dr. Sims? I'm putting out an APB. Give us a call and let us know. Thank you very much. Thank you very much.
Okay.
Okay, there you have it. Coming into that gun lab, folks. You can still get in on this. About 5 minutes left to go. The number to do it, 412-825-6262. That's 412-825-6262. Let me run through these 10 important things you want to know about mammograms that are pretty much a joke, but it's what they're doing, folks. It's how they're getting you in there. Second of the two, don't be afraid. Mammography is a fast procedure. They say about 20 minutes, and discomfort is minimal. Don't you believe it that discomfort is minimal, and we'll just move on. The word squish is operational here. Number 3, get the best quality you can. If you have dense breasts or under the age of 50, to get a digital mammogram, all that means is that the mechanism for taking is in a computer. But it's the same doggone thing. No additional benefit. It just happens to be the technology of our era. But the thing is done the same. It's read the same. Its specificity is the same. Not a good reason for having it. I tell you before, bring your past mammogram films in with you. By the way, do you have your past mammogram films? And by the way, if you don't, I actually think that's a good idea. It is your right. You're entitled to get those just by asking, by going to the hospitals, to the repository of them, and they have to give them to you. It's the law, folks. They have to do it. Number 5, be loyal, they say. Once you find a facility and you have confidence in it, try to go there every year so that you can get that you can get your mammograms and be compared from one year to another to another. That actually is a good thing in terms of comparing them. The fact that they're never able to detect the lesion early enough is my problem with mammography. Number 6, ask if your center has CAD, which is computer-aided detection. This supposedly helps the radiologist find areas of concern. I'm not too familiar with it. I'll just move on with that one. Don't wear deodorant or antiperspirant to your mammogram, since these can show up on the film. Really? And interfere with the test results. That's what they're saying. This one, I thought was a bit of bravado here. Mammography is our most powerful breast cancer detection tool. That is true for the conventional medical community. Remember, we have thermograms in our realm. Now, that is a good study. However, mammograms can still miss 20% of breast cancers. Folks, it's a heck of a lot higher than that. I have to tip my hat to the fact that they're at least willing to mention that, okay? But the number isn't 20. It's significantly higher because every breast cancer that gets a start started little and then it grew. And it wasn't detected until it had grown. You need to learn about the presence of the lesion when it's so tiny and hasn't grown yet. I don't seem to get the message. Number 9, an unusual result requiring further testing does not always mean you have breast cancer. It is the criticism of today's studies. It turns out that they send doctors on a goose chase, a wild goose chase, to nail down lesions that either aren't cancerous at all or that would never have led to a problem for the woman who has it. And then finally, the last one, women should get mammograms. They say once a year beginning at age 40. These protocols are in error. Should be every other year and should be starting at age 50. Hey, I had to get my shots in. We'll wait till October and I'll explode. Want you to have a wonderful weekend, folks. Stay tuned to our Monday show. I'm going to go through a list of everything we do here to try to sort it out because it is getting confusing. It's even getting confusing to me. So until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.